Yeah.
Hello, yes, good
Hello, Emma.
morning, everybody.
Hi.
Hi there.
All right, Emma. Hi.
Thank
Hi.
you,
So,
Deepak.
hello. You're right. Thanks so much for pulling this together, and no pressure, keynote speaker, and all of that, like we discussed previously. so,
I'm definitely not the keynote speaker. Thank you ever so
so,
much, everybody.
Emma, I'll allow you to introduce yourself, and then after your session, I think what we'll do, we'll have an opportunity for a 5-minute Q&A, and then take a break. So, over to you, Emma.
Lovely, thank you. Good morning, everybody. Thank you ever so much. Thank you, Tom, for doing the slides. Really appreciate that. So I'm Emma Chaplin. I'm the lead cancer nurse across Mid and South Essex Foundation Trust. So very much talking from the kind of acute trust side of things today. But I think the talks have all been fantastic this morning. And it's really great we're all together to kind of move forward in trying to work together as a system and really improve our care and support for people affected by cancer. So the things I'm going to be talking about today are the national and local aims for cancer, actually, which Deepak's covered very well as well. So I'll just touch on certain aspects of that. And the Living Well Cancer Programme, which is a new programme that we're running within the Trust, so I'll talk more about that. Beetroot C, which is our new IT platform for cancer. SACT at Home, I will mention briefly, which is our chemotherapy delivery at home. TYA, which is our teenage and young adults affected by cancer, and MCC Cancer Champions, which is a new initiative we've started as a system-wide process to try and increase engagement and improve working in partnership with those affected by cancer. So Deepak's very clearly talked about the NHS long-term plan. The area that I very much wanted to focus on within the plan is that every person diagnosed with cancer should have access to personalised care, which includes a holistic needs assessment, a H&A, a care plan, and health and wellbeing information and support. An holistic needs assessment is very much about discussing with person affected by cancer their physical, psychological, spiritual and social needs. So it's looking at the person as a whole. It's very much directed from the person affected by cancer, because actually they're the expert. They know what needs they have. And it's very much about listening to what the support and care they need from us. So it's an opportunity to talk through their worries and concerns, and to clarify their needs and ensure that we refer to the most appropriate support and services. And actually, if you look at the data on holistic needs across the country that we've collected from people affected by cancer, the overarching and the most reported effect that people have from cancer is worry and anxiety. Regardless of what tumour site they have, what cancer they have, what age they are, actually the most reported effect that people have is the worry and anxiety. And I think that's really important to remember. And actually that shows us that across all professions, nursing, allied healthcare professionals, in primary and secondary care, actually we're all capable of supporting that and making that better for people. I won't go into about early diagnosis because I think Deepak's covered that really well. And very much around we wanting more people to survive, but not only just survive their cancer, but actually live well and better with a cancer diagnosis and living post-treatment. And we run the long-term effects within a clinic within the trust. And I think it's very much about supporting people to live and live after cancer. That's actually key to supporting people. So just to talk about our population, we obviously cover a wide population. We've merged as a trust. So we're now one trust from Basildon, Broomfield and Southend. Our cancer centre is based in Southend, but actually the patient cancer pathways goes across the whole trust. So actually people often have to travel between the different hospital sites. And that can be quite draining for people physically, emotionally, and also financially. There can be huge pressures on people because of the cost of having to travel across sites, the time pressures, and the stress as well of having to travel across sites. So I think it's very important we have an understanding of the difficulties of people having to have their care across a large system-wide population. So we have radiotherapy based in Southend. And we have our chemotherapy or SACT treatment centres at Broomfield and Southend. So people from Basildon often have to travel to both sites to receive either radical surgery or radiotherapy or chemotherapy. So we have to be very mindful of that, of supporting people to travel. We do have Macmillan information hubs across the 3 sites, and we're trying to improve those hubs so that we can have them well staffed with people that are hugely knowledgeable about cancer and can support people. We do have within those hubs support for financial support and welfare, and also information and signposting on local support groups, psychological support, WIG services. So a great asset to our trust and to patients locally affected by cancer. And as a community and in primary care, you're more than welcome to contact any of those hubs for support on what services and support are available for people locally. Next slide, please, Tom. So we're looking at how we're going to improve and transform our cancer services across our trusts over the next 5 years. And as we've talked about, it's very much about improving education on what cancers potentially can be prevented or picked up earlier through screening. And I think Deepak's highlighted we've got some work to do there, and we could really look to how we can improve, reaching out to improve access to screening. We very much want to improve early diagnosis, and improving diagnosing people within 28 days is a key target that we very much want to work towards. And as well as actually improving the pathways to ensure that people have the best care at the best time. Next slide, please. So our Living Well Cancer Programme is something that I'm leading on within the Trust currently. We have employed a number of allied healthcare professionals. So we now have a physiotherapist, an OT, dietitian, nurse specialist, psychologist and support worker. And we work with a number of level 4 cancer personal trainers that deliver online and face-to-face cancer-specific exercise across the community settings. So we've worked with non-profit gymnasiums and leisure facilities, mainly across Chelmsford and Basildon area, and we're working towards rolling that out to Southend as well. So it means that people can access prescribed exercise and activity locally to close to home to increase their overall well-being. And the team has very much come together to deliver a prehabilitation and rehabilitation programme. Next slide, please, Tom. So prehabilitation, just to clarify, is a process around delivering care that occurs at the time of diagnosis and the beginning of acute treatment. So it's about best preparing patients to enhance outcome of medical treatments. So we know that it decreases morbidity, it increases physical and psychological outcomes, increases potential treatment options. And we've seen that with the programme. We've seen people that have come into our clinic, that have not been able to have radical surgery. They've failed their pre-anaesthetic workups, and actually from going through our prehabilitation programme, we've actually enabled them to get fit enough to able to go on to have radical treatment. And that's for patients is a huge benefit. It also reduces our hospital readmissions. Next slide, please, Tom. So prehabilitation is very much about interventions and making every contact count. And I think that's something we work through primary and secondary care, is very much about how we can make every contact count with every patient. We have our universal, our targeted and our specialist pathways. And this has been designed by Macmillan Cancer Support in 2020. It's very recent. Research has been published, and nationally there's a big drive to work towards having a prehabilitation and rehabilitation programme for every person affected by cancer. And we know that it really does improve outcomes for people. The universal pathway is very much a generic pathway for people that are relatively well. And we see that typically with people affected by breast cancer, normally can be very well and want to improve their overall health, and can go out and we can deliver pathways, prescribed exercise programs that can be delivered virtually. Then we have our targeted and specialist pathways, and actually we've seen very much those for people with lung cancer or upper GI or lower GI that may have actually been unwell for a number of months, that may have lost a huge lot of weight, had decreased input of nutrition, may be very lethargic. And actually it's very important that we design a very personalised care plan for them that can ensure they're supported with OT, with physiotherapist, and also psychological input as well. Next slide, please, Tom. And you can see there that, again, from Macmillan Cancer Support, we very much need to be proactive and not reactive. And you can see when people have diagnosed without prehabilitation, actually their general health, you can see rapidly decreases there. And can actually, without prehabilitation and rehabilitation, when living with and beyond cancer, can actually really tail off and can decrease quite a large amount from when they were initially picked up and diagnosed with cancer. But within putting in prehabilitation and rehabilitation, that curve can really start to pick up and we can really see improvements with general health. And that not only improves people living with and beyond cancer, but can actually improve their overall health as a whole, which is a system and for a patient is a huge benefit. Next slide, please, Tom. So intervention before treatment, you can see there actually patients with low functional capacity, again, with no intervention and after treatment can really tail off their capacity. Their functionality over time. And actually with inputting with prehabilitation, Bromby et al. Actually last year proved through this study that we can see that can really begin to improve with this intervention. Next slide, please. So this shows a national model from 2018, the multi-facet model of actually putting prescribed exercise and physical activity, optimizing people's nutrition and optimizing their psychological well-being. And actually we've seen this a great deal. As I mentioned at the beginning of the talk, people most report worry and anxiety. And actually that can have a huge impact on their physical and their mental health. It can impact on sleeping, on eating, on relationships, their overall self-esteem. And actually people have said that very much we're brilliant in the acute trust at delivering chemotherapy, delivering radiotherapy, but actually we haven't always been so good at actually supporting them emotionally through treatment. And this is where we've also worked hard to put in cancer support workers who are Band 4 level trained, that can work with our cancer nurse specialists and very much be about supporting their emotional well-being. And what we want to see is actually working more as a system to link better with our practice nurses and our social prescribers, to actually really give a whole person-centered approach and actually support their overall well-being. And I think we can do that and actually would be a great support to patients. Next slide, please, Tom. So prehabilitation not only reduces short-term harm, but actually improves long-term behaviour and health. It can reduce hospital and ICU lengths of stay, reduce post-op complications, and we also know that it can reduce side effects of treatment and possibly reduce the potential of the cancer coming back. So huge potential to improve the patient's overall care. Next slide, please, Tom. Thank you. So this is our Living Well with Cancer Prehabilitation model. So within clinic, we have the OT, the physio, the dietitian and the nurse specialist, and we very much assess the patient as a whole. And we see them at diagnosis. We see them and we prescribe their own personalised prehabilitation plan. We then see them before they start treatment, post-initial treatment and post-rehabilitation. Rehabilitation, we prescribe exercise that is delivered at community gym settings. And also they have the chance to come in and have sessions personally with the physiotherapist. We've spoken to a number of patients and evaluated this locally within Mid and South Essex. And actually we've seen that it's really improved patient and it's been really well evaluated and patients really love the additional support that is offered. Next slide, please, Tom. So at Recruitment, it's open to all tumour sites, it's open to all stages of disease, so also patients with palliative care needs as well. At the moment, we're offering it to Broomfield pre and rehab and patients Basildon rehabilitation, and we're very much working to be able to commission this across our trust as a whole. Next slide, please, Tom. So there's just to show you our clinic held in the physiotherapy gym in Broomfield Hospital. Next slide, please, Tom. So we do a number of metrics within the gym, the clinic, sorry. We very much want to assess functional capacity, nutritional status, and very much patient-reported outcome measures. So very much around our frailties assessment, performance status, quality of life, people's psychological well-being, and their overall physical and mental health needs. So very much the patient gets a really good assessment. Next slide, please, Tom. We also prescribe patients, everybody gets a MyZone, which they wear on their wrist, and that actually tracks their heart rate, and that's recorded electronically, and that's able to, our anaesthetists and our physiotherapists are able to, and if you go on to the next slide, Tom, you can see that data being tracked, and we can actually see the impact on patients' heart intensity, the intensity of their workout, and that can really give us evidence for how that patients increase their activity, and actually can formulate the basis for deciding on treatment plans for that patient. And actually I was quite concerned about how patients would take using this monitor and how they would take to doing exercise prescriptions online, but actually we've seen a majority of patients have been over 70 that have come through the programme, not exclusively, but a large majority, and actually they really like the ability to be able to do it online and to be able to feel like they're being monitored. It actually gives them that security, and actually a lot of our older patients have said, I would like to be able to do more consultations and gather more information through email, because actually they say they don't have to sit waiting on the phone. They feel that they're actually more empowered to get access information and support online. So that's been really great to hear that. We do also have a number of iPads that we can loan to patients so that there's not that digital exclusion that may come from people being deprived and not having IT support. Next slide, please, Tom. So our take-home messages around the Living Well programme are very much that it's a multi-model. It's around improving patients' clinical outcomes. It's about being proactive, really empowering patients, and focus on the muscle status, not just body weight and functional capacity. So very much patient-centred care. Next slide, please, Tom. I just want to talk a little bit about Beetroot, which is our new IT platform. We knew that within the trust we had quite a bit of work to do to improve our IT, and actually it's something that patients report within the National Cancer survey that they really would like to see communication improved. And what Beetroot does for us, and what we're building with the company at the moment, is a cancer care database for clinicians that we can monitor and track patients' pathways. We can also, gives us the ability through text messaging, we can send patients questionnaires such as quality of life, frailty scoring. We can do that all through now questionnaires sent to the patient through their smartphone, and then that can be displayed not only internally within the hospital, but also we're working to that be a system-wide, so that we can share reports to patients and the GPs in the practice, so that we can share that information at a much speedier process. And what it also does, if you can go on to the next slide, Tom, is actually works on our PSFU program, which is Personalised Stratified Follow-up. We know nationally that research has shown that actually routinely following up patients following cancer treatment is not actually in their best interest. It doesn't always meet their needs, and it also, research shows that it doesn't actually pick up a recurrence of cancer. Actually, what often picks up a recurrence of cancer is the patient themselves. If they notice symptoms, very quickly they would often contact either their GP or the acute trust, their CNS, their cancer CNS nurse specialist, and actually report those symptoms. Routinely picking people up to clinic isn't in their best interest and doesn't suit their requirements. So what we're moving towards a national program, initially in breast, colorectal and prostate cancer, to actually monitor people remotely. So for breast cancer, for example, we would send them for a mammogram by text message. If that mammogram was normal, we would send them a letter to explain that was normal and they didn't need to come to hospital. They have the support of a nurse specialist throughout that pathway, and are very much around, we ensure they have an end of treatment summary which highlights them what signs and symptoms to be aware of. And actually knowing that they can come through directly to the nurse specialist at any point if they have any questions or concerns. And actually this is shown to be hugely effective and really does meet the needs of those affected by cancer. Our next step is to work with neuroendocrine tumours, and also to work within our rapid diagnostic service to actually really ensure that those people that have suspected cancer that don't have cancer, that we report to them very quickly the outcome of their treatment, and that's not their treatment, sorry, their diagnostics. Next slide, please, Tom. So this just shows how it would look. So patients can see, they have to sign in, they would be given their own personal sign-in, and also as staff, we would have our own sign-in for that. Next slide, please. And you can just see this is very much around the patient portal, how it would look. They could view any alerts they have. So it may say to them, you need to go for your PSA test today. Please remember to go and have your blood test. They would be able to view their results. They'd have a calendar showing their upcoming details. So it may say to them, you've got a colonoscopy next week, you've got to have your CEA blood test next week. And it would also show messages. So it would show them maybe any questionnaires. Very much we're working with the urology team about very personalised questionnaires, maybe about sexual function and their quality of life functions. So very much a personalised approach that very much the patient is in control of and can view those results and have communication on a two-way process, which I think is a really great step forward for us caring for patients affected by cancer. Next slide, please, Tom. SACT at home. I'm really sorry, I've got nothing in this slide. I was hoping for some feedback from colleagues. But just to say, SACT is obviously our chemotherapy, our biological, our immunotherapies that are delivered. As I mentioned, we have the two chemotherapy suites. We have one at Broomfield and one at Southend. And we've been very fortunate to have a new chemotherapy suite at Broomfield that has increased our capacity from 14 to 20 chairs. So we're able to deliver more chemotherapy at a much faster or less waiting time for patients. And we've also developed a model where we can deliver chemotherapy at home. And that often is things like injections, so immunotherapy injections, maintenance treatments such as Herceptin that we use in breast cancer. And again, that's been very personalised and really been tailored to have to reduce people coming into hospital, having to wait in hospital in our chemotherapy units. We know that it's been hugely well evaluated. People really like having chemotherapy or maintenance treatment in their own home. because it means they don't have to travel to hospital. They can be within their own setting, which is much more comfortable for patients. So that's been a huge development within our trust. Next slide, please, Tom. I just wanted to mention about teenage and young adults. This is our 16 to 24-year-old age group. And just to say that previously it was noted that we didn't have as much support in Essex as we did nationally, and especially as our London counterparts. So we did a number of engagement sessions with people affected by cancer in this age group, and they highlighted to us that actually they didn't feel there was as much support, there wasn't as much communication that they would have liked to have seen. And actually I felt really passionate about improving this pathway and this care for this age group. And we also noted that people weren't being discussed in the UCLH, our primary treatment centre, MDT, as much as they should be. And often people in this age group were having to travel to London to have pre-chemotherapy blood tests. And actually this was a huge burden for this age group to have to travel to London for their blood tests. So we've worked really hard locally in Essex to really improve this pathway. We've been able to be funded by Teenage Cancer Trust for a full-time CNS, so a nurse specialist specifically for people in this age group. And we know that we have around 50 new cases a year, so actually not an insignificant number of people that are affected by cancer. We've really made improvements with hospital at home so that they can have their pre-chemo bloods at home now. And we've really made links with their primary treatment centre with UCLH to really increase the number of people being diagnosed and discussed at a specialist MDT to really ensure that they have the treatment and care that they deserve. We have our nurse specialists doing home visits, so reduces their attendance to hospital, and this was something that was implemented during COVID. And also working with Queen's and our local CNS to deliver online virtual support groups, which has been really well attended. So I'm really proud of the support and care that we've improved with this group. Next slide, please, Tom. And just lastly, I just want to mention our MCC Cancer Champions. And Dr. Liz Towers has been really key to supporting us and driving this new group forward. It's something that we want to work as a system. So we want to work with our primary care trusts around really working as a team with the secondary care colleagues to work with patients that have been affected by cancer, so that we can co-design, we can co-work about what we want, what patients want from cancer going forward. How can we support people? How can we reduce those inequities? And how can we shape future cancer care? So very much around being equal partners around what we need to improve in cancer. Next slide, please. So just my last slide, just for those that have been affected by cancer, please do encourage them to get in contact with us, and we can share this. I'm sure Tom can share this round. We have an email address, we have a phone number. Please do encourage people that want to come on our committee or want to feedback on where we need to make improvements in cancer care locally. We'd very much like to hear from them. And just to say to colleagues, if anybody would like to spend some time in the Acute Trust, attend any of our MDT meetings or come and see the chemotherapy or radiotherapy suite, please do get in contact with me. I'd be very keen to show you around our Acute Trust and join up links so that we can really work together to improve cancer going forward. Thank you very much for listening.